Hello, and welcome to another episode of the Harkin Institute's Lunch and Learn program, empowering businesses, families, and communities with health savings plans. Today's focus are health savings plans, also known as HSAs. Today we have Matt Stagner, who is an expert on health savings accounts, as well as myself, Brad Biren. And today we're going to not focus too much on FSAs like last time, but we're going to look at what are savings plans just for people with high deductible health plans. And so we're going to continue on to looking at what those can be used for, not only for saving money and taxes now, but Matt's going to delve into the retirement and investment opportunities that HSAs have for people that are eligible for those. And so, as always, we have to have a little bit of a disclaimer, as all professionals do. Our views here are not those of the Harkin Institute, the state of Iowa, or any one of our employers. If you have any questions about your rights and responsibilities or anything that you've heard today, remember to seek out a professional, as everyone's situation is, of course, different. Like I said earlier, my name is Brad Biren. I have a background in both law and tax, and we have Matt Stagner, who is a lead advisor at the Foster Group. He's a wonderful professional that I encourage everyone to get in contact with. If you do have questions specifically for today or for Matt, after the recording is finished, you're welcome to contact us and email us immediately with any questions that you have. And so we're going to continue on just stemming from our FSA, switching over to our HSA topic. So it's important to know the distinction once again, so we're just going to cover this a bit. An FSA, or flexible spending account, is a mechanism for pre-tax income of W-2 employees that offers both health insurance and an FSA. So that's the employer has to offer both of those. And then you can pay with that money for medical expenses. And HSA is different in that it's also from pre-tax income, but the person who's eligible for it has to be enrolled in a high deductible health plan. And we'll talk about that a bit more, about the distinction between those two. Now, what does tax advantage mean? So according to the IRS in general, almost everything is taxable. So there are a couple of exceptions, which we'll show you right on the next slide. So there are some exceptions to the rule, and so tax advantage is one of those exceptions. It means that it's income that's not taxed, but for the use of a carve-out like FSAs and HSAs. And so this is different from tax exempt, tax deductible, and tax credit. And Matt can tell you there are so many distinctions in the law between all of those different things, and they are important. So how are FSAs and HSAs similar? So now both our vehicles are tax advantage, which means that your contributions are not going to be taxed. Both accounts reduce your total taxable income. Both reduce your payroll taxes for the employee, as well as the employer. Now, there are a couple of big important differences that we need to cover, and those are crucial for understanding the benefits when weighing both FSAs versus HSAs. So there are three types of FSAs, but only one type of HSA. Employers' contributions to an FSA are not tax deductible, whereas an HSA, it is deductible for the employer, any contributions that they put in. Funds within an FSA last for only 1 calendar year. Generally, there is a carryover of it depending on your plan, so do read the guidelines carefully. HSAs last indefinitely. So with that, all rules follow with spending, but the calendar year does not matter for you. Now, upon death, your FSA funds are forfeit, anything that's left, whereas HSAs, they can be given to any sort of designee, usually a relative. Now, what are deductibles, premiums, co-pays, and out-of-pocket expenses? All of these are very important terms, of course. So a deductible is how much you must pay towards your own healthcare costs before health insurance will take over the majority of payments. A premium is what you pay each month to the health insurer for coverage. A copay, I think we're all familiar with copays probably, is an amount of money one pays at the point of service at any given appointment. So when you go to your doctor, that's when they say you owe us $10, $15, $20, $30. That's usually your copay. Now, out-of-pocket expenses are those excess medical costs that you're required to pay according to your health insurance plan. So sometimes it'll say your deductible is met, and after your deductible, you'll be paying 20% of all future expenses until you hit your out-of-pocket expenses. So those words are very important to understand. Moving on, I want to know who's eligible to open up an HSA account because it is quite different. And so an FSA, it has to be offered by your employer. Here in HSA, we're looking at the term eligible individual. And so that's a very unique term for HSAs. And the definition for eligible individual, with the IRS is specific to HSA plans. So it means any employed person does not have to be a W-2 employee. It could be any type with a high deductible healthcare plan and has not signed up for Medicare and is not a dependent. The source of the high deductible health insurance plan does not matter. It could be from the marketplace, through your employer, or privately. Unlike health insurance plans that require FSAs, those have to be through the employer. So what is a high deductible healthcare plan? For the years 2024, these are the numbers for understanding whether or not you've crossed that threshold in order to become an eligible person that is eligible for an HSA. So the minimum annual deductible is $1,600 for an individual, or $8,050 for a family. The out-of-pocket expenses for an individual is $8,050. Now, for a family, that's going to be higher. You'll see the numbers are exactly doubled. $3,200 for a family, and then the out-of-pocket expenses being $16,100. But remember, each spouse that wants an HSA, they each must open their own individual accounts. So HSAs are tied to individuals and not family units, and that's very important to understand. So what if your deductible is less than $1,600, but your out-of-pocket expenses are more than $8,050? So I went straight to the IRS, and the definition, according to them, is that if either the deductible for the family as a whole or the deductible for an individual family member is less than the minimum annual deductible for family coverage, the plan doesn't qualify as a high deductible health plan. So what that means is that if your out-of-pocket expenses are less than $8,050, you do not qualify. So the $8,050 for your out-of-pocket expenses has to be there and be met. So if I have family coverage, how will I know when I've hit my deductible? Now, there are some family plans that have deductibles for both the family as a whole and for individual family members. Under these plans, if you meet the individual deductible for one family member, you don't have to meet the higher annual deductible amount for the entire family. Now, if one spouse has a high deductible healthcare plan coverage and the other does not, both spouses must be eligible in order for both to have an HSA. Now, all of this covers medical expenses, which is also very important. But now we also want to consider and pivot towards investment and retirement. And this is where it's so important to speak with a professional such as Matt in order to understand your ability to use an HSA for retirement investment. So we're going to start off with Matt explaining to us what happens if you change your job and you have an HSA or FSA.
Yeah, thanks, Brad. Appreciate you covering all the basics. Now I get to talk about the fun stuff.
Yeah.
The difference between an HSA and an FSA, as Brad mentioned, is the FSA is really tied to your employer. The HSA is your own account. So as long as you qualify based on whatever healthcare plan you're using, you can have that HSA and you can keep it with you. So what I really enjoy about HSA is that it's your money. You take it with you if you lose your job. You can take it with you into retirement even. And it creates some really interesting planning opportunities if you do so. So that is the big difference at FSA. If you leave your employer, that is your employer's account. Whatever's left over in there, the employer can keep. The HSA is yours. You can keep it with you. In fact, in some cases, like for myself, I have an HSA from my previous job. My new employer says you can contribute to whatever HSA you want to. So I just kept the same HSA from my last job. I'm still contributing to it through my new employer because it's my own account. It's a separate account. You can move between HSAs once within a 1 year period. And you can change where your HSA is administered without doing a rollover. So you essentially can just sign papers and move over to a new HSA. So it is important to note, again, if you're using an FSA, which usually comes along with those lower deductible plans or those plans that just have a copay instead of a high deductible, then you'll want to spend whatever's in that account prior to the end of the year, or definitely before you leave that job if you leave within the year, because you don't want to surrender any of your own money that you decide just because you've left or changed. So again, back to how an HSA works. You can open up your HSA anywhere. As an individual, you can contribute up to $4,150 a year. Family limit is $8,300 now. Those will go up every year. These are tax-free contributions. So you often hear people refer to HSAs as triple tax-free. That's because it is deductible to the employer. It is tax-free contributions that you make out of your paycheck. So it reduces your income. And then when you spend the money, whenever it's time to spend the money, as long as you follow the rules, it is tax-free when it comes out. So it's a great way to reduce your income, to take, just like we talked about with FSA, but you can take expenses that you're going to pay anyway and make them tax-free or tax advantage, depending on how it works. So you can use your HSA the same way you use your FSA if you want to. So you can put that $4,150 or $8,300 for a family, tax-free money, put it in the account, and then throughout the year, you'll have a debit card. You can swipe that for any eligible HSA expenses, and there are a lot. And we'll talk about some of the fun ways to use your HSA funds later, but you can use it as money in, money out throughout the year, just the way you would an FSA. But if you happen to be in a situation where you have enough income that you can contribute to your HSA and still pay for your expenses, your medical expenses each year out of pocket, that opens up the opportunity in the HSA to keep that money in the account, keep it tax-free, keep it growing, because you have the opportunity to invest that money for the long term. So that's what's really, really unique about HSAs, is that it's not only a tool for this year to save money, but as Brad mentioned, you can keep it with you throughout your life, keep it with you through retirement, and you can invest that money for your future.
You had a fantastic statistic just before this started about the number of people who have HSAs versus how many use it as a retirement vehicle.
Yeah, there's a lot of people now that are eligible for HSAs, and more all the time, because the trend in employer plans has been towards high deductible plans and away from low deductible plans. So more and more people are eligible for HSAs all the time. But right now, only about 9% of those that have an HSA have invested that money for the long term. So that means you can extrapolate from that and say 91% of people who are using an HSA today are using it as if it's an FSA. They're swiping their debit card, they're paying those expenses as they go along, as opposed to investing that money for the long term. And we can talk about the reasons you might want to invest for the long term. There's another stat that you may have heard somewhere else, but for retirees, a couple going into retirement, healthcare ends up being one of your biggest expenses throughout the rest of your life after retirement. If for couples retiring, I think at the age of 65, on average, you're going to need about $318,000 to get through your retirement as a couple. If you're just a solo person at that point, men 166,000, women 197,000. So it's maybe even more important for women because healthcare costs tend to be higher. So it's really important to think about those future healthcare costs. So how do you defray those costs? How do you minimize that or plan ahead for that? And HSA can be part of that solution, because that money invested now can be used for future healthcare expenses. So you can bank that $8,300 if you're a family every year. If you don't touch it, and you invest that money within the HSA, when it comes to retirement time, you can have a pool of funds. Again, the numbers will vary depending on your investment performance and what you spend and expenses and things like that. But you can build up several $100,000 in an HSA as just another retirement account. There's some huge benefits to doing it that way.
And just to make sure though, that even in retirement, your HSA still can only go to medical expenses, not towards anything else, like a house or.
Yes and no.
Oh.
So in general, an HSA is strictly for medical expenses. And we'll talk about some of the eligible expenses in a moment, but once you reach age 65, there's no longer any penalty for using HSA funds for anything. So if you wanted to buy a private jet and you had enough money left over in your HSA after your health expenses, at age 65, you can do so just as if it was another retirement account that you built up. So generally, we're using these for healthcare expenses, and most people are going to have enough healthcare expenses over their lifetime that they're not going to have a private jet left over in their HSA. But if you did, you'd have that option.
It would be great if we all had, from an HSA to get a jet.
All right, so who can contribute to an HSA is important because, as Brad mentioned, you have to be an eligible individual, which means that you have to have a high deductible healthcare plan. That's the main thing. You can contribute to your own, which lowers your taxable income because it takes money that you would be paying taxes on out of your paycheck and moves it up to be pre-tax dollars. Your employer can contribute. In fact, for those of you that are business owners or are employers, it's a great incentive for employees. You want to help them understand, help them enroll in high deductible healthcare plans because that's what's important to your benefits package. Help contribute to their HSA. So the employer can contribute, whether it's a match. They also have, a lot of times your employer may have incentive programs. I've worked for places that had, if you complete certain activities like getting an annual physical or doing some physical activity, they'll contribute additional amounts to your HSA. So take advantage of whatever funds are available from your employer, if you're an employee, or if you're the employer, think about using your HSA to incentivize your workers to take care of themselves and to participate in the plan.
And to also help keep employees, I would think too, this is a great opportunity for employers.
Yeah, if you're looking at two different jobs and staying where you are and going somewhere else, your benefits package for a significant portion of the population is going to be one of the main determining factors of whether you stay or go. And so enhancing your benefits package with HSA contributions is one way to keep your qualified employees. You could have other family members contribute to the HSA as long as you don't exceed those total family limits. Obviously, if you're over the family limit, you're going to get a notice at some point that says you need to take money back out of that HSA because you over contributed and you have to correct that. But there are a lot of different places where you can bring money from. In fact, there's one more way that is not listed here. If you have an IRA or a Roth IRA, you have the opportunity to move money one time in your lifetime from your retirement account into your HSA. So you could do that if you had medical expenses and you needed to take some money that was earmarked for retirement and make it use it for medical expenses. You could do that. You are still subject to the annual limit for the HSA, so you can't roll over more from your IRA than what you have remaining in that year's limit. But it is another way for you to fund your HSA, to convert some pre-tax dollars into tax-free dollars if you use them for medical expenses through your HSA. So a lot of different strategies for funding your HSA. There are some limitations to that we'll talk about, but it's important to understand whether or not you're eligible, and then make a plan for contributing to your HSA. Make it part of not only your benefits election every year, but you can change it throughout the year, by the way. It's not like other benefits where you're stuck on a certain contribution amount. You can change that as often as your plan allows. But also make it part of your retirement plan, make it part of your financial plans to say, this is a tax-free account, triple tax-free, that allows you to do a lot of different things, including pay current expenses or plan for the future.
A nuts and bolts question now. So if you have an HSA instead of an FSA, how do you invest that money? Who do you talk to invest that money?
Well, as always, your investment choices are going to be determined by the plan that you're enrolled in. And if you need help with your investments, obviously talk to a financial advisor, your financial planner, whoever you work with. Generally, the way it works is within your HSA, there's gonna be two buckets. There'll be a cash bucket, which is basically a checking account that allows you to leave money in cash and spend it with your debit card. And then once you reach a certain level, usually $2,000 or $3,000 within your cash bucket, your HSA plan may offer a series of investment choices for you to pick from. Now, it's not wide open. You can't buy Bitcoin or gold or, Nvidia stock. You really have to use what options are available within that plan. And generally, they keep that very simple for you. So it's a group of mutual funds, and you'll pick your risk level that you're comfortable with: conservative, moderate, aggressive, and you'll pick that basket of funds to invest your money in through that plan. But again, there's some really significant advantages to getting that money invested, because you're compounding that growth over time. You're building a future asset, just like you would within your 401k or your 403b or your IRA or other retirement vehicles. This gives you that option to grow that money and compound that growth over time. So the way you get money into an HSA, which I think is also a little bit of a difference between the HSA and the FSA. Both you could have it deducted out of your paycheck. We've covered that. Tax treatment is very similar for you, the employee, and for the employer, if it's coming right out of your paycheck. We talked about the fact that your employer can put money in on your behalf or give you incentives to use in your HSA. You can move money from traditional Roth IRAs or MSAs, but you can also contribute out of your pocket in your HSA. So if you have extra money in your bank account, maybe you haven't maxed out your HSA for the year yet through your employer, you can contribute with a check or cash, or link up your bank account to your HSA and add additional money up to that annual contribution limit that you can then invest or spend depending on your needs and your situation. You have until April 15th of the year following the prior year. So you have, for those of you watching live, you have until Monday to put additional money for 2023 in your HSA account. And that allows you to make sure that you hit that maximum if you're close to it, or if you're able to do so before you turn the table over to 2024's contribution.
And with IRAs, aren't there also things called simple IRAs? And so how come I see that those aren't on the list? Is there an exception there then? With people who have simple IRAs versus traditional IRAs or the Roth IRA. So it seems like there's differences between what accounts we can use to roll over into our HSA.
So you generally can't roll over out of an employer sponsored plan. So from a 401k, 403b, SEP IRA, it really needs to be a personal account. Now, a simple IRA is arguably somewhere in between. So I don't know if you have specific thoughts about the simple as an exception, but generally it's a personal retirement account to a personal health savings account.
I understand. So simple because it's a little bit more mixed. We have to focus on our personal accounts that we roll over.
Yeah. And your simple IRA is going to has a little bit different restrictions as far as when you can access the money as compared to some others. So check with your plan administrator if you have a simple, check with your financial planner to confirm whether or not that's eligible. All right, so if you have an HSA at your old job and an FSA at your new job, nothing changes. So that's the good news. You're not going to lose the money that you put in your HSA just because you're no longer using an HSA. In fact, there's a lot of scenarios in life where you're no longer going to be HSA eligible, but you still have the money in the HSA that you can use in the future. Like retirement, like we talked about before, like once you start Medicare, you can no longer contribute to an HSA once you're on Medicare. But you can spend the money that's in your HSA once you're on Medicare. So there may be scenarios where you're no longer contributing to your HSA, but you'll still have that money available to take money out.
Oh, so people would probably, if they are offered an FSA through the employer, even if it's not tax deductible to the employer, they want to spend the money first and then tap into their HSA.
Absolutely. The FSA, as we talked about, you have to use by the end of the year or by the time you leave that employer. So you'll certainly want to make sure you exhaust that first. And there may be some really strategic ways you can use an FSA with an HSA. We talked last time when we talked about FSAs that you can't use a standard medical FSA with a medical HSA, but you could use your dependent care flex spending account along with an HSA. So if you have dependent care expenses. Fund those with that FSA, make sure you exhaust that by the end of the year. For health expenses, you can use the HSA and contribute to it or use that over a longer period of time. So there's a little, every situation is a little bit different. So again, talk with your employee benefits specialist or your HR specialist at your job, or your financial advisor, if you need help trying to figure out which one to contribute to and which one to take money out of. But it's a good rule to think about. Whichever one's going to expire at the end of the year, you might want to drain that one first.
And it's important to remember that you can't take your you cannot take your FSA funds that you have each year and put it into your HSA and think, oh, I didn't spend my FSA money, might as well just transfer it. You cannot do that. Contributions to HSAs cannot be made when you're FSA, when you have an FSA.
Right.
That's important.
Yep, but back to other ways to fund your HSA, I forgot to mention, you can do gifts. So if you have family members, loved ones that you want to give them a tax-free gift and help them with their future or current medical expenses, you can do so. Pay attention to your gift tax exemptions over your lifetime. Talk to your CPA or your financial planner about that, but you do have an option to give gifts to others to put in their HSAs. You can have a spousal contribution. So if you have a scenario where both spouses are using one person's employer plan, and that makes them eligible for an HSA, and the other spouse has not done anything to make themselves ineligible, then you can contribute based on the fact that you're covered by your spouse's plan. So there may be other opportunities to fund it. And my favorite that we haven't mentioned yet is, due to the Affordable Care Act, you can stay on your parents' insurance until you're age 26. You can actually contribute to an HSA through your parents when you're still covered by your parents' insurance. So if your parents have a plan that allows you to contribute, you can do so, even if it's not your plan, if it's your parents' plan, which you're covered under.
So instead of asking for a gift card under the age of 26 or money for a car, you could always say, I need money for my HSA, and hey, your parents might appreciate that even more. So there's an opportunity for early
Tax-free
savings.
money for medical expenses or future retirement. Absolutely.
So what if the employer and I contribute more than the limit in a single year?
Well, just like any retirement type of account, the IRS puts limits. If they give you tax benefits, they take them back if you don't follow the rules. One of the rules is don't contribute too much. So if you contribute too much, you have to start claiming the excess amount as taxable income. And there's an excise tax that you can, for the amount that's over that limit. Sure, you can deduct that excess contribution, you can remove it, you can, there's a lot that you can do to remedy that situation, but if you contribute more than the limit, generally you're gonna wanna quickly fix that before the end of the year so you don't have to pay those extra taxes.
That's a good thing to remember.
I think we're gonna talk a little bit about Medicare, which is a popular topic for many when it comes to healthcare.
Yeah, so now we're having the largest, I believe, last month of people turning 65 in the United States in its history. So now what happens once you enroll into Medicare?
So this is a big planning implication for HSAs. As you reach age 65, you have to start thinking about when you're going to enroll in Medicare and how that affects your other healthcare plans. You cannot contribute in your HSA when you're on Medicare. And in fact, I believe it's within the same year as which you turn age 65 and you join Medicare. So you have to plan ahead and say, I'm not going to contribute to my HSA in that year that I turn age 65. At age 65, in many cases, you have to opt into Medicare, or you should opt into Medicare, at least Part A, unless you have qualifying coverage through your employer. There's some complications around that we don't have to get into the details, but in general, you're going to enroll in Medicare Part A when you're age 65.
And so, but you have the opportunity or option to stay on your employer's healthcare if you wanted to after the age of 65 and not enroll in Medicare.
You do have that option in many cases. So as long as you're not on Medicare, you can contribute to your HSA. You can continue to spend it either way. So this may come into play as you're trying to make this decision around Medicare. You'll want to look into, hey, just because I'm 65, do I have to enroll? or can I put that decision off? In the case where you work for a larger company and you have good coverage, generally the government will allow you to defer that decision. If you're self-employed, work for a small company, things like that, it may not be an option for you. But if it's an option, that could be part of your plans to delay Medicare a little bit while you're still working and contribute to that HSA.
And for those of us that are on Medicaid, but we had an HSA beforehand, we want to look at the limits for asset limitations for people on Medicaid, because the asset limitation of $2,000 is hard and fast. And so therefore, if you have an HSA still open, you want to contribute to it, and you're on Medicaid, watch that limit. Jeff.
Absolutely. Medicaid or SSI or supplemental security income, any of those programs that have an asset limit, and HSA is money that you have access to, therefore it's going to count against you. So you can contribute to an HSA, but just make sure that your HSA plus your money in the bank plus any other accountable assets are under the limitation for whatever program you're using, whether it's Medicaid, SSI, SNAP, or others.
And so it's very interesting. You're next going to be telling us about long-term care and HSAs. Can you tell us about that fantastic benefit?
Yeah, so you'll see a rule, and a lot of times you'll see even in our presentation, we'll talk about how HSAs can pay for your out-of-pocket medical expenses. But generally speaking, you don't use an HSA to buy more insurance. Now, this is one of those exceptions, and it's a really important one. A lot of people don't realize that Medicare, which is the retiree healthcare plan that most people in America use, does not cover long-term care, which means skilled nursing facilities, assisted living, home health care. There's strict limitations on what you can get out of Medicare for those programs. If you need long-term care as you get older, as many people do, there's statistically 7 out of 10 people will need some form of long-term care in their lifetime after age 65. It's something that people have to pay attention to. It can be very, very expensive to pay for out of pocket. There's only a couple of ways to fund long-term care expenses. You can have enough money in your savings and your investments, in your retirement accounts or whatever, that you can pay for it out of your pocket. It may be $100,000 a year, but if you plan ahead, you can self-insure. If you don't plan ahead at all and you have no assets and no income at that time, or very limited income at that time, you can apply for Medicaid, and Medicaid can pick up the cost of that long-term care. But that's not ideal either, because it limits the type of care you get, the type of facility you can use, and you don't have the opportunity to save and be financially independent. So the third way to cover long-term care expenses is to buy long-term care insurance, which is a specific type of coverage where you can pay and outsource that risk to an insurance company. So you'll pay premiums. The insurance company will then cover the expenses up to certain limits of your long-term care if and when you need it. You can use your HSA to pay those premiums. There's some limitations to that, but it is a way to plan for that eventuality of, hey, I might need long-term care in the future. It's very expensive. Those policies have gotten only more expensive over the years as the cost of long-term care has risen as well. But this is one way to help offset those costs and really leverage your HSA to not only cover health expenses, not only save you money on taxes, but potentially protect you in the case that you need long-term care facility, inpatient type care.
So now, premiums are what we pay each month for health insurance, and you said we can't have money go towards our premiums for insurance. And so it sounds like what you're saying is that we can't use our HSA funds for purely health care expenses or to pay for things like Medicare Advantage plans, but we can use it just for long-term care premiums.
So there are some exceptions to that. Long-term care is one of those. You can also use it for Medicare premiums. So your primary Medicare, so Medicare Part A is what everybody gets, and most people don't pay anything for it. Part B, you're required to enroll in, and everybody has to pay for that. You could use HSA money to pay your Part B premiums. Medicare Part D is your drug coverage through Medicare. You can use HSA money to pay for Part D premiums if you want to. I do think that there are ways to use it for Medicare Advantage premiums, just not Medigap or supplemental plans. So again, speak with a well-qualified insurance professional or financial planner to dive into your situation, but there may be ways to use your HSA to help cover those premiums, those monthly costs, those ongoing costs of maintaining insurance. There's one other really small scenario where if you leave an employer and you're on COBRA, if you've ever heard of that, which is like to continue in your employer's plan, you have to pay the premiums after you terminate from service. You could use HSA funds to pay COBRA premiums. You could also use HSA to pay premiums on health insurance if you're on unemployment. So in those bridge situations where you're not quite on Medicare, but you're not at your employer anymore, there may be some little narrow scenarios where that works for you. Again, make sure you get your team together when something comes up like a job change. Talk to your planners, talk to your insurance professionals. There may be some things you can do there.
That's pretty interesting how you can pay for things during a gap in employment and during this economy where no one can predict what's going on. You provided now the extra option for all of us to pay for those premiums.
Yeah, there's more people retiring unexpectedly, I would say,
Unexpectedly.
over the last few years than in the past. So when those job changes come up and you want to explore all your options and make sure that you're covered, make sure you don't have a gap in your insurance coverage, and saving in your HSA now can help shield you against that scenario where it could really hurt your finances in the future. So if you're able to, again, with your income, if you're able to both fund your HSA and pay for your own healthcare expenses some other way, not from your HSA, then you build up this pot of money that shields you in case of a future job loss.
And now this is very important, the next part, as to why you want to talk to a professional like Matt, because he has so many ideas for how you can invest your money with HSAs. Can you tell us more about that?
Sure, as I mentioned before, there's generally the option within every HSA to have some money available to spend and some that's invested for the long term. All the growth, the interest within that HSA program is tax-free as long as you ultimately use it for qualifying medical expenses when it comes out. So now you obviously have to understand that every investment comes with risk, and you have to pay attention to the expenses of those investments. There's a lot of disclaimers that come along with investing in markets, but this gives you that opportunity to grow your money tax-free, maybe end up with a significant pot of money so that you have more options when you retire or leave your job. Maybe you have to save less of your income into retirement accounts if you fully funded your HSAs. Maybe you'll be able to live on more than just Social Security if you haven't saved for retirement, if you've got money in your HSA to cover the medical aspects of those costs. If you're going to use it for future medical costs, the best advice that I've ever heard is save your receipts, because you don't have to pay medical expenses in the same year that you had medical expenses. You just have to show medical expenses to offset whatever money you take out of your HSA. So if you've got things like kids' braces, surgeries, treatments, things that are very expensive, medical expenses over your lifetime, and you're able to fund those other ways, save the receipts, save those invoices so that in retirement, if you need some extra money for whatever reason, you've got documentation of healthcare expenses. You can now take a tax-free withdrawal to match that expense, even if it's later on down the road. So that's a way to, again, think of this as an additional retirement account by using it for medical expenses, both past and present.
That is genius. So we can complain about how much we have to spend on kids' braces now, but in the future we can pay it off.
You could pay yourself back for it. Absolutely.
That's ingenious. And so now an employer's obligations in terms of health insurance and HSAs are a little bit different. So according to the Affordable Care Act, only employers with 50 or more employees must provide health insurance to at least 95%, which is pretty much all of their staff. And employers do not need to offer an HSA. An HSA is independent for the individual. So the employer does not, if your employer does not offer an HSA, then you still can open an HSA account on your own, which is very different, remember, from FSAs, which have to be offered by the employer. So if your employer contributes to one qualified employee, though, they have to contribute the same amount to any employee that is also eligible. There can be no cherry picking or picking favorites amongst employees. And so how do employers benefit from offering and or funding HSAs to their employees? And so just a warning, the next few slides are going to have some math, but before the math starts, employers do not have to contribute to anyone's HSA. That's not mandatory in any way. But if an employer does, they do offer, they being the government, they have to offer it to everyone, and the government does offer benefits to the employers. Employer contributions to an HSA are deductible, as we said, to the employer. Employers also benefit from a reduction in how much they pay in matching payroll taxes. And so even if that employer does not contribute to your HSA, your contributions to your HSA help both you and your employer a little bit there because of the savings that you're providing them as well. And so here's where the math starts. We don't want to make anyone too overwhelmed, but it's important if you want to demonstrate to your employer, if they don't already contribute to your HSA, print out this slide and show it to them. So in general, your employer matches your FICA, and that's what's going towards your Social Security and your Medicaid, Medicare, and your FUTA, which is your unemployment tax. So both employers and employees each pay FICA, but only your employer pays your FUTA. So only your unemployment taxes are paid by the employer. Your FICA is about 7.65% or up to for the first $168,800 of your income. And FUTA is 6.2%, but functionally we say it's only 0.6% because your employer gets back 5.4% if they file a specific form. And that's up to the first $7,000 of your income. Now, if we look at any pre-tax funds paid into an HSA, they become tax excluded for both the employee and the employer. So taxes are assessed pretty much based upon your taxable income. So any money that's placed into an HSA is going to be excluded from the calculations for taxable income. So that reduces the overall, we say, gross taxable income for the employee. That means everything that's left over to be taxed. So we see that employers pay their portion of FICA and FUTA based upon the total of all their employees' gross income. So the IRS asks the employers to add up all the taxable income that they are paying out to their employees, and that's what they're going to pay a tax based on. So any reduction in that overall gross tax of all their employees will help reduce what employers have to pay towards FICA and FUTA.
So this really works for both employees and employers. You're saving money on your federal income taxes, you're saving money on your Social Security, Medicare, or FICA taxes, both as the employee and as the employer. So it's really like you're getting a return on your investment. Again, it's all perspective here, but it's effectively like you're getting at least 7% on your money already before you even invest it, because you're saving that much in taxes in that year that you're never going to have to pay as long as you follow the rules of the HSA. So it's a really effective way to leverage your money that way as well.
So it sounds like what you're saying is that an HSA, because you're not paying income tax on it, or in this case, state tax with it, you're really compounding the value of each dollar in HSA. So $1 in HSA is really worth more than $1.
Absolutely. And again, that's for both the employee and the employer. So the employer saves money on their side as well.
And so HSAs, there are some financial considerations for them, especially for an employer that provides money towards an HSA. So HSA balances are not based on the calendar year we're about to see. So HSA's balances are not based on the calendar year. The balances are not reset to zero. And that's very, very important because timing is so important for many reasons, but especially for HSAs and their testing period. Now, the testing period for an HSA is very specific and it has a whole bunch of rules that we are not going to cover in this presentation. It could be its own presentation. But if you hire a professional just like Matt, they'll help explain it to you and they'll make sure that you meet those tests. And so it costs the employer about $60 a year to pay a third-party administrator to process your claims. And that sounds like a lot of money for the employer and for the employee to maybe have to cover. But the average employee contributes $2,147 to their FSA yearly. And that's about 63% of all the HSA contributions. And the average employer contributions is about $869, or about 26% of all HSA contributions, and that's across the country. So how does that math work out for the employer's favor? And so we're going to look at some numbers now that specifically look at hypothetically how much money your employer can save. So $2,147 of what you've contributed times that 7.65% for FICA equals about $164.25. And that's a tax savings for both you and your employer. Now, this is an automatic reduction in cost for the employer of $104 per year per employee once you subtract any administrative costs that might be associated, like the $60 we mentioned earlier. If the employee has a family high deductible health plan, you want to look at the HSA and the pay in the maximum contribution of $8,300. The employer benefits even more. If you think about that, they can put in $8,300 times that by FICA tax, and that's $634.95 in tax savings. Once again, for the employer and the employee. And that automatically reduces their costs an additional $530 or and 95 cents just in FICA taxes alone. If we add in FUTA, that's another small amount, but it's almost $13 in our scenario there. So the total savings for the average employer is almost $550. So employers can deduct both FICA and FUTA expenses under IRS regs. And so if you have any questions or are wondering, how can I use this to my benefit, or how can my employer use it to their benefit, especially if you want to have your employer start contributing, take these numbers and show it to them. And that could be pretty convincing to any employer to not only retain you, but also to lower their own tax expenses.
So you're showing that the tax savings for employers more than offsets any expenses that it costs to maintain that plan.
Exactly. And so that's where a lot of employers don't understand that HSAs are not superfluous money. They are real benefits that their employees can use, and their employees recognize that. And so an employer has another option, another tool in the toolkit in order to reduce how much money they have to, in order to retain their employees. So any income you earn is considered pre-tax before you pay tax. And the federal government taxes us all on our income, with a few exceptions, like we said before. One of those exceptions that we are talking about is money placed into an HSA. And so this means that you don't have to pay income tax on the portion of your income that you place in an HSA. So if you pay $1,000 into your HSA, that is $1,000 not being taxed in your total income tax with the IRS or with the state. So here's an example. If you make $50,000 in 1 year as an employee, which places you in the 22% tax bracket, and you contribute $2,147 to your HSA, you would pay $2,147 times 22%, because that's your tax bracket. And that equals to $472 in savings for you each year. And that's where the $1 into your HSA account is actually worth $1 and almost a third or a quarter extra. So that savings and that contributions is really where you save a lot of money. The FICA savings now is $164 for you, and that makes a total savings, because we're not adding FUTA into there, of $636 towards your tax bill for that year. So that $2,147, when you combine it with your tax savings, is actually worth $2,783.59. So that's where your dollar is worth more than $1. So it's not dollar for dollar, it's dollar and a quarter almost that you're putting into there. And so let's have Matt explain to us how we can spend the money once it's in your HSA account, because he has so many fantastic ideas. And so what are you thinking about here, Matt?
Yeah, so that's a good explanation of why you might want to contribute to an HSA. Again, the fun part is spending money, whether you're spending it now or you're spending it in retirement. You can spend it on nearly anything that qualifies as a medical related expense. Again, generally not health insurance premiums with some exceptions. If you want to look online, you can just go to Google and search for HSA buy, and you'll find a bunch of different options. Amazon has a whole page dedicated to ordering things that are HSA eligible. But here's some things you may not have thought about. So as we know, you can use it for doctor's visits. You can use it for telemedicine or telehealth visits. You can actually also use it for prescription drugs, of course, or over-the-counter drugs. So sleep treatments, cough suppressants, pain relievers, like anything that you would buy as an over-the-counter medication, you can use your HSA card and purchase those. Again, now or in the future. You can also use it as of 2020. This is the tiniest of tiny silver linings from COVID, is we're now allowed to use HSA dollars for women's healthcare products, including tampons and pads, birth control, contraceptives, all of those things are now eligible HSA contribution or HSA eligible expenses. So you can use that money for those expenses that you may have on an ongoing basis. We mentioned braces for your middle schoolers. Again, in the past, you can do that now as it comes up, or you can save those receipts and use that money, reimburse yourself later on. You can use it for vision, contacts, glasses, optometry visits, all of those things. You can use it for transportation to and from healthcare. So if you have to travel to another state for healthcare purposes or another place, your HSA can help you pay for that transportation to get there for those covered expenses.
So a lot of people go up to Mayo. You're saying that they can use their money from their HSA account and pay for that transportation up to Minnesota.
Yeah, as long as the treatment that you're getting there is an eligible medical expense, which it generally is going to be under an HSA. Travel there is important. Here's some others you may not have thought of. Lead-based paint removal. So if you find out you have lead paint in your home, that affects your health. You still have to get a letter of medical necessity to allow that, but that maybe those expenses could be offset. Vasectomies, both vasectomy and the reversal of a vasectomy could be an eligible HSA expense. If you're trying to quit smoking, you can use it for the gum, the patches, whatever you need to help stop smoking. Hearing aids, which are a big expense for a lot of retired folks that are not always covered by other plans. You can use it for that. You can use it for the things that come along with nursing as a mother. So you can use that for breast pumps, pads, storage containers, things like that you may need for nursing. You can also just go buy a first aid kit for your household. If you've got younger kids at home like I do, you're going to run out of Band-Aids at some point. Band-Aids, antibiotic ointment, those first aid items are eligible expenses. So there's lots of different ways to use it. Those that may have diabetes, you can use it for testing supplies, for swabs and needle disposal containers and insulin and all of that stuff, of course. So there's a lot of different ways to use the money as it comes out. And as we talked about tax benefits before, I just have to reiterate that when you take the money out, it's not taxable income to you. This is really, really important during your lifetime, or during your working years when you're in a high tax bracket. But it's also very important once you've retired, because it can affect the amount of money you earn, can affect how much you pay in taxes. It can also affect how much of your Social Security ends up being taxable. So if you have Social Security, it's generally not taxable up to a certain limit, and then from there on, it starts to become taxable. Well, if you're spending money from your IRA or from a pension that is pre-tax money, you're adding to your taxable income every year. If you instead spend money from your HSA, it does not increase your expenses, does not increase your taxes. Therefore, it's not going to increase the amount that you'll owe on your social security. So it's just a little ancillary benefit for retirees. There's a lot of ways to keep your income, your taxable income low in retirement while still having access to these funds. And also, one final thing, as you get older, if you've got money in any qualified retirement account, 401k, 403b, traditional IRA, you'll have something called required minimum distributions, or RMDs. Once you hit age, their ages are scaling up at 72, 73, or 75, depending on how old you are today. HSAs have no RMDs. You can keep that money in there tax deferred, tax free throughout your lifetime. You don't spend it. You can leave that money to somebody else. You leave it to a spouse, and it stays as an HSA. You can leave it to others, and with minimal tax impact, they can inherit whatever's left. So a lot of options, a lot of tax savings there. And I know we just kind of are about out of time, so maybe we should wrap up with any final thoughts. We talked about all these tax benefits. Obviously, you can't, if you use your HSA to pay for an expense, you can't then claim that as a deductible medical expense. If you happen to itemize your taxes and qualify for medical expense double, yeah, but that's also a pretty narrow swath of the population now, the way the tax law is set up, that are both itemizing the taxes and have enough medical expenses to offset that. So, as with anything, when it comes to the government and taxes, they're generally going to want to get paid sooner or later. But if they don't, like in an HSA, they're going to put restrictions around that to make sure that that you're getting some benefit out of this. They're incentivizing you to save. They're incentivizing you to be healthy and to take care of yourself and to use medical care when you need medical care now and throughout retirement. So they give you a lot of tax incentives to use the HSA. As long as you follow the rules, it ends up being a pretty good deal.
Sure thing. And so, as you said, time is coming for us to wrap things up, but a few things, key things to remember. An FSA is for the calendar year. HSAs sound like almost forever. When you do open an HSA, you want to remember to direct the administrator, or when you fill out the forms, to have a designee, let's say upon death or incapacity. So we make sure that goes on to your family and is not lost. As well as you mentioned that we have to pay taxes on our Social Security income. And so all of those things considered, HSAs are a wonderful vehicle for both the employer and the employee to pay healthcare costs well into retirement. So that's why we want to talk to people that have expertise in it, like Matt, in order to help offset any of our costs in retirement, because those sound like they're going to be quite high. And so thank you everyone for coming today. If you have questions, we'll of course answer them after the presentation. Those of you who came today, thank you so much. And we shall have another presentation similar to this, but on another topic in the near future. Thank you, Matt, for coming and for us today to this presentation. And my name is Brad Biren, and thank you from the Harkin Institute.